Hi, my name is Christian. I'm going to be doing my head-to-toe video presentation. So the first thing we're going to want to do is knock on the door, hand hygiene, and then don on gloves. Okay, then we're going to introduce ourselves to the patient. Hi, my name is Christian. I'm going to be your nurse today. I'll be doing a head-to-toe assessment on you. Do I have consent to assess your body?
Yes.
Okay. Can you give me two patient identifiers, your name, your full name, and your date of birth?
Jane Doe, 10/12/97.
Okay, I'm going to look at your wrist bracelet to verify. That checks out good. Okay, so first thing we're going to do is take the patient's vitals. So her vitals come out as 120/80 blood pressure, heart rate is 65, respirations is 18, temperature is 97.7, and O2 saturation is 98% on room air. Okay, now I'm going to assess the patient's pain scale. Are you in any kind of pain today?
No.
Okay, 0 out of 10 on the pain scale. And then also, when's the last time you had a bowel movement?
Yesterday morning.
And do you have any trouble voiding?
No.
Okay, so bowel movement was yesterday and no trouble voiding. So now we're going to begin with our assessment. I'm going to start at the head. Okay, no bruising, no lesions or anything abnormal, no types of infestation. Now I'm going to test the patient's skin turgor on her neck. So patient's skin is non-tinted, so well hydrated. Now I'm going to move to the patient's eyes. Can you look at me? Patient's eyes are symmetrical. Sclera is white. Now to look at the pupils. Okay, and then can you look at the tip of the pen light? Follow it with your eyes, don't move your head. Okay. Patient's pupil are equally round, responsive, and reactive to light and accommodation. Now I'm going to assess the patient's nose. The septum appears midline. And now to do a breathing test, inhale. Okay, patient's nares are patent. Okay, no bleeding or drainage noted inside the nostrils. Now to look at the sinuses. Sinuses are not swollen, so that's good. Moving on to the patient's mouth. Lips are pink and moist. Can you open your mouth? Oral mucosa is intact, teeth are intact, and palate is movable. I'll go now to the patient's ears, and there is no drainage noted on the ears, no bruising or redness on either ears. Okay, so now moving down to the patient's neck, I will look at the trachea, which appears midline. No jugular vein distension, and lymph nodes are not swollen. Okay. So now I'm going to also take the patient's lung sounds. Breathe. Breathe. Okay, and then can you sit up forward? I'm going to assess the posterior lobes. Okay. Inhale. 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 can sit back down. Patient's lobes are clear, non-labored breathing, and chest rise is asymmetrical. So now I'm going to assess the, also take the patient's heart and listen to her heart rhythm. Okay, patient's heart rhythm is regular, no abnormalities noted. So now I am going to go onto the upper extremities. Can I see your hand? Okay. I'm going to assess the capillary refill, which is less than 3 seconds on both hands. Radial pulses on upper extremities are +2 bilateral. Can I see range of motion? Can you do move your shoulders and arms? Okay, range of motion appears fully intact. Now for a strength test, can you put your hands out? I'm gonna press down. Okay, strength test is normal. Now for the capillary refill on the feet. So cap refill on the lower extremities is less than 3 seconds. And then pedal pulses are +2 bilateral. Can you move your legs and perform range of motion on your legs? Okay, range of motion for lower extremities is intact. Now I'm going to press against your feet. Okay, strength test on lower extremities is intact. Now I'm going to also take the patient's abdomen. Okay. Okay, patient's abdomen has peristalsis in all 4 quadrants. Now I'll palpate. Patient's abdomen is non-distended. So now I'll move forward onto our gait and balance test. Can you stand up? Can you touch your toes? Okay, and then now for balance test, I'm going to press against you. Maintain your balance. Okay, patient center of gravity and balance is intact, well coordinated. And can you take 2 steps forward and 2 steps back? Okay, you can sit back down. Patient's gait is well coordinated, so center of gravity is okay and steady. Now for our final questions, I'll ask for your full name, date of birth, the month, and then the year. Can you tell me?
My name is Jane Doe. Date of birth is 10/12/97. The month we're November 11th, 2023, and I live in California.
Okay, so a patient is A&O times alert and orientated times 4, and if I were to rate this patient on the Glasgow Coma scale, it would be 15 because the patient has verbal and motor responses fully intact. So now to end our assessment, actually I forgot one thing, a general skin assessment. So, okay, let me see your arms. Okay. Okay. Let's see your back. Alright. So general skin assessment, patient's skin is intact. It is no bleeding or bruises noted throughout the entire body, no signs of pressure sores. And now to end our head-to-toe assessment, I'm going to remove gloves and then hand hygiene. I'm going to say goodbye to my patient and then exit the room. Hand hygiene and then say goodbye, exit room.